Hi, my name is Isa Tahir, and my presentation is about the comparison of the United States and Germany healthcare systems. Slide 1. At the heart of every great country is a well-built healthcare system. Some vital components to any healthcare system are quality, cost, and accessibility, also known as the Iron Triangle. Each of these factors correlates highly with one another. If there is a reduction in cost, then quality and access will be reduced. Conversely, if there is a need for better health quality and more access, then cost will have to increase. An effective healthcare system should have balance between these three components. The German and American healthcare system share many differences and few similarities. Following the three basic components of the Iron Triangle, they can be compared in a fair manner. Slide 2. The United States healthcare system is run mainly by private companies with little government involvement. In the United States, it's not mandatory to have healthcare. However, in Germany, it is mandatory. Also, in the United States, Medicare, Medicaid, and managed care, such as HMO and PPO, make up the health insurance. In Germany, they have sickness funds and voluntary health funds. Slide 3. The United States system is made up of private health insurance, Medicare for the older population, Medicaid for the needy, health maintenance organizations, and PPO, Preferred Provider Organization, which offers more flexibility in return for a copayment. The difference between HMO and PPO is HMO you can choose from a select few physicians within the network, and PPO you can choose physicians in or outside the network. Slide 4. High expense of medications. One of the biggest factors in America's healthcare system is increasing healthcare cost. The United States spends more on healthcare than any country in the world. Physicians incorrectly receive the blame for rising costs. Something else is uncovered by diving further into the critical parts of healthcare spending. Technology, authoritative costs, hospital costs, lifestyle, and constant illness conditions have all had more prominent effects on escalation in healthcare. In healthcare, in healthcare service costs than doctors. Probably the largest patron to rising medical costs is authoritative expense. $360 billion is spent every year for authoritative expenses as assessed by the Centers for Medicare and Medicaid Services, and 85% of excess authoritative overhead can be credited to the insurance company. In addition, doctors are frustrated by the expanding authoritative guidelines as it detracts from patient care. 20% of cancer patients cannot pay for their medication, and this is due to no negotiations of the prices between government and pharmaceutical companies. Each year, cancer treatments go up by 10%. Slide 5. Price variations. Hospitals around the country also charge vastly different prices for the same procedure. In fact, the distinction could be just about as much as 200,000 across the country. Costs shift enormously from one state to another. In 2013, the expense for treating heart failure in the three most expensive states, California, New Jersey, and Nevada, was around $70,000. It was under $15,000 in Maryland, Montana, North Dakota, Vermont, and West Virginia. Even hospitals within the same city may charge different prices. For example, in Jackson, Mississippi, the expense of heart failure procedures goes from a low $9,000 to a high of $51,000. With no reason for the widespread differences in hospital fees, the significant expense of healthcare in the United States has helped medical tourism become a major industry. Slide 6. Turner referred to the instance of an uninsured 53-year-old North Carolina man who required heart medical procedure to supplant a mitral valve. A nearby medical clinic assessed the expense for the surgery at $200,000 and requested a $50,000 deposit. After much examination, the man and his wife went to New Delhi and had the surgery performed without problem. The couple returned home 1 month later. Their absolute expense, counting traveling and housing, was $10,000. Medical tourism exposes one of the many flaws within the American healthcare system. A healthcare system should be affordable enough that people are able to get the treatment they need in their own country. Furthermore, not everyone has the privilege or health conditions to travel. Therefore, medical tourism is not a solution for everyone. Slide 7. Access to healthcare can be characterized and estimated in a couple of ways. Usually it alludes to the percentage of people inside a country who have healthcare coverage of some kind. The most recent data from the US Census Bureau for 2020 found that 301.9 million individuals, or 92%, had health insurance, and 26.1 million individuals, or 8%, of Americans did not. Another element of access in some cases is the waiting time for services. A contention frequently made by the individuals who go against the healthcare systems embraced by different nations is that their residents have long wait times for services. However, the data appear to be mixed on this issue. For example, 57% of Americans surveyed stated that they received a same-day or next-day appointment when sick. The second lowest percentage among citizens of 11 OECD countries surveyed. In addition, 19% of Americans surveyed stated that they had to wait 6 days or longer for an appointment when sick, the fourth highest percentage among citizens of 11 OECD countries surveyed. Slide 8. Introduction of the Affordable Care Act in 2010 was the most recent major reform to healthcare in the United States. The Affordable Care Act was endorsed into law by President Barack Obama on March 23, 2010. The legislation includes thorough healthcare reform with the intent to improve quality, expand coverage, and affordability. These actions are in effect right now and will continue to be implemented in coming years. The most popular part of the Affordable Care Act is its mandate that requires most people to obtain insurance. All individuals are required to follow the mandate unless they get insurance through their employer. The Affordable Care Act was successful in increasing accessibility but also forced people who did not want coverage before now to pay for it. Slide 9. In Germany, many organizations and persons in this way established the institutional structure of the German healthcare system. It is commonly and obligatory to have healthcare insurance in Germany. Many countries have a similar system. Germany has reformed their system multiple times since 1970 to include artists, students, publicists, and farmers. The sickness fund covers people who have little money, the oldest, and the sick. With more people insured, it meant that there was an increase in expenditures for the system. On average, employers, employees, and taxpayers pay 195 billion euros annually towards the health fund. The health fund was introduced in 2009 to cover each insured person. There are also the private health insurance funds, which include the healthiest, youngest, and those who had the most income. Members who did not benefit from the funds are refunded annual bonuses. With statutory health insurance and private health insurance, 90% of the German population is covered. Slide 10. Accessibility in Germany. The universal healthcare system in Germany has created makes health insurance The universal healthcare system Germany has created makes health insurance very accessible. In 2009, a law was introduced that required all residents to have some type of health insurance. However, there is still a small amount of people that were uninsured due to the complexity of the system. As of 2015, the estimate is 100,000 people, or 0.1% of the population, remain uninsured. The group that is at highest risk of being uninsured are self-employed people with low income. Refugees and migrants are among the uninsured and limited access to healthcare. Health programs in Germany create opportunity for almost everyone to receive healthcare. Migrants and asylum seekers are entitled to emergency care. However, Germans are not totally satisfied with their benefits as it is becoming common to purchase voluntary health insurance to cover dental care co-payments. In 2016, nearly 1 out of 4 Germans had complementary insurance, for example, to cover a hospital room or dental care. Around 80% of these voluntary health insurance contracts cover dental care even though sickness health insurance benefits incorporate fractional installments for dental prosthesis and orthodontics. Significant user fees apply. Overall, the Germans have a low number of unmet needs in healthcare. One of the rising problems, however, but not a major one, is the out-of-pocket expenses. Inequalities in out-of-pocket payments were common according to the International Journal for Equity in Health. Those who had higher illness levels also had a higher demand for health services. A higher demand for services then meant more resources were used, ultimately leading to a higher out-of-pocket payment. Age was also a factor in out-of-pocket payments. Higher age normally results in lower health status and more use of healthcare services, and higher out-of-pocket payment in the end. Inequalities for out-of-pocket payment for services that German healthcare programs provide are very small when compared to the United States. For example, Germany's average financial burden due to out-of-pocket payments was 3.23% compared to 19% for Medicare beneficiaries in the US. Out-of-pocket expenses in Germany are significantly lower when compared to the US because of Germany's efficient systems. In the US, much of these expenses paid for by patients do not make sense. An example of this would be a patient receiving care for a simple headache that would probably be cared for with aspirin, costing less than $1 in Germany, but in the US, it might require an MRI amounting to thousands of dollars just because the physician and the insurance companies want to make extra money at the expense of the patient. The United States healthcare system should be the best system considering it spends more on healthcare than any other country in the world. However, the government struggles to reform the system. Some call the 2010 Affordable Care Act a failure, but it did succeed in improving quality and expanding coverage to 92% of Americans. The United States needs a great reduction in cost and accountability for where the money goes. Germany has a more successful system compared to the US even though it still has multiple problems including high out-of-pocket expenses and a small number of uninsured individuals. Both the United States and Germany have room for improvement in all areas of the Iron Triangle. Struggles with quality, accessibility, and cost have troubled both systems from their beginning and will remain a struggle until they master each component to a successful healthcare system.